Back with Dr. Osterberg. Dr. Osterberg, tell us, give us a few samples where, like, for instance, a patient has pain, be it in the head, be it in the shoulder, be it in the legs, be it in the back, lower back, upper back, maybe even arms, whatever, where, yes, he has pain there, but really a different part of the body might not be functioning. Can you give us some examples there? Because most of us, when our shoulder hurts, we think it's the shoulder. And I have seen with my chiropractor, or sometimes my wife, and she goes and it's actually, she pushes me and punches me, and said that the source of the pain is really quite somewhere else than actually where it really hurts. Can you give us some example there so that our patients get enlightened to it and pay attention that a headache isn't necessarily a headache? I mean, it is a headache. Don't tell anybody he doesn't have a headache when he has a headache. But that it originates not in the head, and it's perhaps not a chemical deficiency of Tylenol which causes it.
Yes, absolutely. Probably the most common example has to do with posture. And it has to do with something called upper cross syndrome, or very simply forward head posture. And we've all seen it before. You get somebody who has kind of a slouching posture and they carry their shoulders rounded forward and their head is shifted forward. And you brought up the example of headaches. That's the most common cause of headaches that we see in our office. As the head shifts forward, it increases the amount of tension through the muscles in the neck, increases the amount of tension in the traps and across the shoulders and down between the shoulder blades. And somebody can have this posture because they sit in an office chair all the time and they're just slouched forward. Or they can have this posture because they have a problem in their lower back and it makes them lean forward to make their back feel better, and they don't realize that they're getting neck stiffness and they're getting headaches because of this lower back issue. So whenever we address patients, we're looking at the entire body. We're looking at their posture from head to toe. We're looking at flexibility in all parts of the body. Okay.
So basically, a bad posture pulls some muscles and stuff in other parts, or makes like as you said, the head forward, so obviously it needs a lot of muscle to keep it that way. More so than if it sits straight on it, anything which sits straight on something has less, pressure, and then headaches come, and maybe some people keep going. Are there some people who, for instance, because of headache, they do all kinds of medicine and tablets and all kinds of, and it just doesn't go away?
Absolutely. Absolutely. Headaches can be a very frustrating condition for the people who have them, because it can come from so many causes. They can come from hormone imbalances in the body. They can come from emotional and mental stress. They can come from allergies to foods. They can come from so many things. However, when we take all of that into consideration, we screen our patients very carefully to try to eliminate the people who have more serious medical conditions, headaches coming from very high blood pressure or other serious medical issues. But once we take all of those patients out of the picture and we look at success rates treating people with headaches, and it doesn't matter if they're migraine headaches or if they're actually tension headaches, what they call cervicogenic headaches coming from the cervical part of the spine, from the neck, we get a 73% success rate in a very short treatment time. We're talking about within 4 weeks, within 1 month, 73% of our patients are experiencing fewer headaches and they're experiencing less severity of symptoms. So certainly I wish we could get results for 100% of our patients, but with chronic repeat headache sufferers, that's just not possible.
Okay, well, I'm sure that if a person is out there and has had headaches for a while, the prospect of getting a 70% relief, or to be part of the 70 people who gets relief, it's a pretty good prospect.
It can make a big difference in a lot of people's lives. A lot of times you don't get headache patients to break that cycle completely, but it makes the difference of whether they can go to work or not. It makes a difference of whether they can play with their kids, whether they can enjoy social outings, whether they can have time with their spouse where they can actually communicate and smile versus just being in a room with the lights off. That makes a big difference in the quality of life, and that's really what it's all about.
Okay. All right. Well, so that was all about that the pain doesn't necessarily come from the source of the pain isn't necessarily where the pain is. And a chiropractor, not always. And a chiropractor is a very well-trained person in detecting that, since he's working so holistic with knowing where the nerves originate and where a small little pinched nerve might be causing you problem somewhere else. Or maybe the nerve isn't even pinched, just overstrained or whatever it might be. All right. Well, thanks a lot again, Dr. Osterberg. Very informative.
Thank you.